Well, hello everyone. This is Dr. Mike Chua again, physical therapist and certified dementia practitioner, and coming to you live here in our alternative careers group. And today, I've got a special guest. His name is Dr. Cameron Camp. He is the director of research and development for Center for Applied Research in Dementia. And I just wanted to share what he does, what he do in the dementia realm, and like what I've been teaching the Alzheimer's disease and dementia care seminar through NCCDP, and Dr. Cameron's company had partnered with NCCDP too, and in that way we can educate more patients and therapists and nurses. So again, thank you very much for coming over, Dr. Cameron. Appreciate you. And did I miss anything in the introduction?
Oh, not really. The NCCDP, as we've chatted about before we went on the air, now has an international branch of the company, sort of a second company called the ICCDP, the International Council of Certified Dementia Practitioners. And we offer a course through ICCDP involving Montessori for dementia. It's a 6-hour course online, broken into modules, and those who go to ICCDP to their website can apply to take the course. They can also apply to become certified as a Montessori for dementia professional. And so there are separate fees for the course and for the certification. People can take the course without the certification as an option, though we always encourage them to do that. And Mike, we may do some horse trading here at some point, because if there's an organization that signs up its members for the course and the certification, the cost drops from $125 and $130 per person for the course and certification to $35 for each of those, which is an amazing bargain. So if this is something that the members would be interested in, and that you'd like to talk to Sandra Stimson at ICCDP about, this is something that we could offer, and we're offering other organizations right now.
Oh, wow. Well, you know what? For $125, $135 for a certification, I think it's very good, because I charge $247 for the CDP course. So, and it's online too, right? So, yep. And it's also just for our group, ACG Alternative Careers Group. The reason why I wanted Dr. Cameron to come over, because like what I said, we want to offer different options for you guys. I know I've been sharing the Certified Dementia Practitioner course here in the group, but I also want to bring over other options for you guys. Several months ago, I also interviewed Teepa Snow, Dr. Cameron. As you very well know, her, Teepa Snow, and we want to give you all the different options, Alternative Careers Group. In that way, you can get all the resources. Second question, Dr. Cameron, what is the Montessori way? I remember we talked about it, and can you explain us what is the Montessori way in approaching with dementia care?
Sure. It's an approach that's based on the work of Maria Montessori, who was the first woman physician in Italy at the turn of the 20th century. She specialized in pediatrics and in rehabilitative medicine. And she combined those two approaches to create an educational system that's based on rehabilitation techniques and philosophies. So, for instance, she said they will learn through their hands. They will learn by doing. And so if you go into a Montessori school, you'll see a lot of activities that are based on use of external aids, task breakdown, task analysis, repetition, the ability to go from simple to complex in a step-by-step manner. A lot of what they call everyday living, we would call ADLs and IADLs. And so it's not just about how to enable a 4-year-old to add 4-digit numbers, but it's also about how to enable them to put away their own clothes and to dress themselves and to prepare food. And so it's a very effective approach that's used on rehabilitation principles, but it also is based on the values of respect and dignity and equality. And so this is what we bring to the dementia realm. We start with that set of values. We have a key set of principles that we try to incorporate in all interactions with persons with dementia. For example, to always invite. So one example of that is to say we get rid of the word can. We do not say, can you help me? But we say, would you help me? That little change, that little change shifts the nature of the relationship. It puts the person with dementia in control of the situation. You're dealing with them as an equal. You're asking for their help as opposed to testing them. Can you do this? Can you read this? Would you do this? Would you read this? So we work real hard at making little changes that actually have a very big impact. Another example is we really strongly advocate the use of name tags that are very, very large, both for the staff and for residents, because we want to create communities, especially in residential settings. A person with dementia wants the same thing that any person wants. They want to know their neighbors. They want to be able to be called by name. So we talk a lot about creating cognitive ramps. Just as you put a ramp into a house up to the front door if a family member is in a wheelchair, in the same way we look at dementia as a disability rather than a disease. And therefore, our job is to enable a person to circumvent their deficits, use the abilities that they do have. And so if I'll give you a prototypical example. A family member comes to visit a resident in memory care and comes out and says, they don't know who I am anymore. They can't name me. They called me by my father's name. Okay. Well, it's not that they don't know who they are. They just can't come up with the name. That's a very different thing. The fact that they used a name that was familiar in the father is not random. But if we can enable the son, in this case, to wear a name tag with his name and your son, then when he comes in and his mother can call him by name, that's a little thing that's a big thing. It shifts the nature of the relationship. And so we look at the capacity of persons with dementia to still learn and how they can still learn. And a lot of those learning techniques and capabilities are those that kick in early in childhood. And so an educational / rehabilitation system that works from birth through high school is also something that then can be titrated, that can be adjusted to the level of cognitive impairment for a person with dementia. And so we work with all stages of dementia. We work with people in earliest stages, and we work in hospice care. I'll give you an example. There's a community, a Goodman Group community in the Tampa Bay area, and they just won a Pioneer Network Award for community involvement. Their memory care residents every quarter select a social concerns topic that they want to work on. So one quarter they gathered materials for the homeless, and they brought in toiletries and toothpaste. They delivered them to the homeless shelter. They collected goods, canned goods and other edibles for a hunger drive for a church that was gathering food for the poor. And when you see these people with dementia taking care of persons who are less fortunate than themselves, working together as a community, you see a process that Maria Montessori called normalization. Normalization is what happens when the environment supports a person, gives them meaningful activity, and gives them a chance to be able to be part of a community. So we talk about resident-driven communities in memory care, where residents choose how they're going to greet new members of the organization, of the community, how they're going to decide where they want to go for outings, what they would like on the menu, what they would like for entertainment, and where they do this for themselves. where they decide how they are going to commemorate the passing of a friend. There's another Goodman Group memory neighborhood in Florida where, for outings, residents regularly go to the hospital to visit the people from their neighborhood who have gone to the hospital. And they make get well cards, and they come to the hospital to see their friend, and they sing and they wish them well. And they've noticed other people don't get visitors, so now they bring extra cards. This is what happens when you're able to humanize memory care, when you're able to focus on how can we enable a person to live as normally as possible. Montessori said, everything you do for me, you take away from me. And you can do everything for a child if you're a parent, and it doesn't end well, because we can teach dependence as well as independence.
You know what? That is so true, and that's where the therapist comes in.
Yes,
where a lot of us, in this group that we're streaming this live right now, and we always advocate movement.
Yes,
and because if we do it ourselves, the passive stuff, we do it passively for them, they start to get weak. And same thing with dementia. So I guess my other question for you, Dr. Cameron, is that would you on the certification course that you're teaching, would you teach all these techniques in the 6-hour course? Is this a live course, or is it a pre-recorded course?
Yeah.
Where can we access you? Where can we reach you?
It's a pre-recorded course, but it has lots of videos from around the world. Okay. For example, there's a food committee of persons with dementia in the south of France preparing soup for the evening meal. There's videos from a wild variety of locations to illustrate the points. It's an online course. You can get information on how to register through our website. You can also go and Google ICCDP and to their website, and you can get a pull down page on the Montessori course there.
We're going to put those links for those people who are interested. I'm sure OTs and speech therapists, they are very knowledgeable when it comes to dementia and Alzheimer's. And I've been teaching this for a while now, and every time we have an OT and a speech therapist comes in the lecture, I'm like, gosh, they know this. And this is going to be an adjunct, like an additional resources, and also a way to network with other practitioners, dementia practitioner. All the certification course, I know we want those extra letters behind their name and stuff like that, but the goal here is actually learning how to network with other people. And this is what I want you to have a group. We call them ACG, Dr. Cameron. We call them Alternative Career Group. So this is what I want you to do, ACG. It's I'm
an ACG. I'm a psychologist who doesn't have an office to do therapy. I don't teach at a university. Most of the time when I do training, I'll see rehab staff there. I'll see activity staff. I'll see nursing. Very few psychologists.
There you go. See,
I went in a different direction, so I hear what you're saying.
There you go. So Dr. Cameron is actually a psychologist, and he transitioned to teaching and doing dementia training. So if we as PT, OTs, and SLPs, whether you're an assistant or a therapist, you guys can attend this course, learn from him. And the more you learn from him, part of it, the students that you will go with them, that will be your own network too. Because remember, your network is your net worth. The more network that you have, the more information that you've got, and the more friends and money you're going to get. Yes, the certification will not increase your salary, ACG, but it will improve your confidence in dealing with dementia. So I don't know if you see it right now, Dr. Cameron. We've got somebody here. Her name is Chrissy Roberts. She says she's a OT, and she says yes. And another lady here says, Leslie said, I've attended Montessori program at last job, and this is so awesome, she said. So are you in Facebook, Dr. Cameron?
Yes, our Center for Applied Research in Dementia is there. We've We've done a lot of postings recently, also on LinkedIn, and starting to have a Twitter presence. We're starting to get a social media person to help us. I would also say we're about to launch the Worldwide Montessori-Inspired Lifestyle Federation. And the cost of membership for an individual or organization will be to contribute one idea a year that people are willing to share. And we will become a repository of ideas for how to improve lives of persons with dementia. For example, in French-speaking Switzerland, when there are nursing homes there, when a family is about to move a resident in, they have to put together a poster with the resident. And on it are pictures of things that are related to the resident's life, like if they like tennis, if they went to Rome. And then those pictures in that poster go into the room of the resident, so that whenever anyone walks into the room, they can say, oh, I see you like tennis. I see you went to Rome. And so it's a simple,
very simple, right?
Yes, very effective way to enable engagement and to let any staff member immediately know something about who this person is. Those are the kind of ideas that we want to pull together and then to disseminate. So watch out for that on our website. In the not too distant future, we'll announce the launching of that federation. It'll be cool.
It's amazing, right? Those simple stuff. I know all our OTs and speech and the therapists here in the group, I know they know all this technique. It's just a matter of implementing it. And with this group, with Dr. Cameron's Montessori program and dementia research, it's going to be a structured program. In that way, you could implement it to your practice. Yeah. So that's our goal here. Go ahead, reach out to Dr. Cameron, go to his website, sign up on the course. Is there any special link that we can get to? I think we're just going to post it on our website, right?
Right. Dr. And Cameron? Like I said, Michael, if you'll get in touch with Sandra, I will let the two of you do negotiation and see if we can get a discount rate for your members.
Yeah, like an affiliate link or something like that.
Yeah, we have a way to do that. So,
All right. Is there any last tip for us, Dr. Cameron, that we can learn from you? I know you're a super busy man, and thank you very much for your time. One last tip for me and for the rest of the group.
All right. Here's a way of thinking. All right. Now, I could take off your glasses, and we have a blog on this that we actually put into the ICCDP newsletter, NCCD. I could take off your glasses, and then I would say this. Mike, I hate to tell you this, but you have Cameron's disease. It affects vision, and you won't be able to see well. It usually gets worse with age. Sometimes you'll stay stable, sometimes you'll progress. I have some drugs to treat it, but they don't work. They do cause side effects. And otherwise, there's nothing much we can do. I can give you the card for a support group so you and other people who can't see well can commiserate. You won't be able to drive now. You'll have to have somebody go with you when you leave the house, and we don't want you to get lost. There's also a support group for people who will be taking care of you so they can talk about how hard it is to take care of someone who doesn't see well, and come back and tell me how you're doing in 6 months. Or I can hand you a pair of glasses and say, here's a way to circumvent your deficit. I can't cure your problem with vision, but we can find a way to circumvent that, and we can adjust your glasses as your vision gets worse so you can still live a relatively normal life. That's the rehabilitation approach as opposed to a medical model approach to the treatment of dementia. And then we say, which one would you prefer?
That is so powerful. And I think that's what's going on with the field now when it comes to treating patients now. We've been focused more on the medication, that we have lost the art of actual caring, the actual touch, the actual listening. Yes. And we've lost that. And I myself, I catch myself doing that, because I would come into a patient's house and I would just come in and I just have to finish that paperwork. I do home health, by the way, Dr. Cameron. I go to different patients' house, and I would just be there and just do my paperwork. And this last patient I came from, you know what he told me? Are you listening? Or are you just hearing me?
Yes.
And at the back of my head, I'm like, oh gosh, this patient really knows what he's talking about. And he told me, you're just hearing me. There's actually a difference between listening and hearing. With this course, with Dr. Cameron's course, they're going to teach us how to really learn how to listen and really apply it to your practice. Yep. So thank you very much, Dr. Cameron, for that word of wisdom. I really appreciate you. I know you're busy, and I wish you all the best. I hope we get some people sign up in your course. For those people who are interested, I see some comments here. Chrissy said, I love this area. My grandmother was at a center that really needed help. I will look at this course. I've been dying to get more involved in helping centers learn more and more. Family needs us so badly. Yes, Chrissy, that is so true. And we need so much more of these clients. And yep, this is so true. Could not be more happy to hear this right now. Yes, Chrissy, go reach out to Dr. Cameron, go to his website or our website, iccdp.net. If I'm not
I'll
mistaken.
give you one more story. My wife is a Montessori teacher, 25 years. Her mother, who had Alzheimer's disease, came to stay with us for a summer, along with her son, my sister's brother. So he was going to the Cleveland Clinic for a summer internship. He goes, and his mother, after 20 minutes, goes to my wife and says, where's my son? And my wife says, he's at the clinic. He'll be back at 5:30. That's what she was wanting to know. 20 minutes later, where's my son? Because the information couldn't be stored in episodic memory. The new events, difficult to remember. But my wife, working with me, Montessori, writes on a piece of paper, Chris is at the Cleveland Clinic. He'll be back at 5:30. Taped it to the kitchen counter because otherwise it goes to a safe place no one can find. Mm-hmm. And when her mom asked the question, she said, there's a message, let's go see. And took her to that location, pointed and said, what does this say? And had her mother do it, her mother read it. Mother reads it out loud. It's the information that calms her down. Perfect. Whenever we want to know about Chris, we can come here. 30 minutes later, where's my son? Same procedure, same words. I think there's a message. Let's go see. So they practiced that a few times. The next day, when her anxiety rose, the mother automatically walked to the location, read the note. Her anxiety is reduced, and my wife's out of the loop. She enabled her mother to learn the procedural learning, that would get her to the location using a technique to allow her to get the externally stored information that calmed her down so that she could reduce her own anxiety. And
amazing.
Cost is a piece of paper and a different way of thinking.
That's so true. Sometimes we just have to think outside of the box. And actually repetition there was the key. That's why we call it rehab. Re means repeat, hab means habilitate or live. In order for that muscle to regain what has lost is to just keep on repeating it. Yep. And a lot of therapists, I don't know about the other therapists in the group, but a lot of therapists, we say that there's no neuroplasticity when it comes to there. Yes, it may not have neuroplasticity, but you can still work on the other parts of the brain.
Yes.
And that's what Dr. Cameron is talking about, teaching and maximizing the full potential of that certain part of the brain. So if the patient can still see and read, go ahead and use that senses. And the more they verbalize it, the more they actually understand it. Because when you see it, you forget. When you hear it, you remember. But when they actually verbalize it and see it and hear it,
all the senses
understand it. Yes. So that's what this Dr. Cameron is going to teach us in the group or in the course. I hope we, sign up to my course too. I'll be teaching the Alzheimer's disease and dementia care seminar this weekend, guys. It's going to be online too. But whether you attend Dr. Cameron's course or my course, the dementia course or the Montessori course, I know it's going to be awesome. The key here is we're learning.
Go to both.
There you go. Go to both. We can give special discount anyway. So the goal here is to we're not making millions here. You know,
Oh,
we're
yeah.
not making millions. If we wanted to make millions, we probably, you know, bought some stock load of stocks in the, what do you call this, in stock market. But no, we're here to bring out the best in you. We're here to bring out, you know, help people more, because I cannot do this by myself. Dr. Cameron cannot do this by himself. The goal here is to educate more therapists, more nurses, more social workers, and that way we can reach more people, not just in your area, but all around the world. So again,
Yeah, Mike, you and I have a mission, not a job.
there you go.
And there's a difference.
There you go. So that's our mission here, is to actually help out, bring out the best in each other. Again, thank you very much, Dr. Cameron. Any last parting words for us, sir?
Let's see. Why not victory?
There you go. Why not victory? We always want to end with victory. So again, thank you very much, ACG, Alternative Careers Group. I really appreciate you for all your questions and comments in the group. And we're going to post this also on our website. Again, always remember the word FAST, ACG, FAST. First is like our Facebook page. The more likes, the better, because, you know, we just want live. We just want more likes. So like Dr. Cameron's Facebook page. He's got a LinkedIn page. We're going to share it in our podcast notes, and also like our podcast right now. The more likes, the better. And letter A, you got to take action on it. All this stuff that we're doing, this is a free video. This is a free interview. You know, Dr. Cameron could have charged me $500, $1,000 for his time right now, but he's not. You know, so take action on it, you know, because the more action that you do, yes, it may not be perfect. You know, you will fail on all this stuff that we're going to be doing, even with dementia care. You know, one intervention today may be effective. Tomorrow, it may not be not. So the more actions that you take, the more failures that you take, the more successes you'll get in life. Letter S.
Montessori said, I welcome my mistakes.
There you go. Even Montessori herself knows that she's going to make mistakes. So that's our purpose here. So the more mistakes that you get, the better. It doesn't matter how many times you failed or fallen or got sick. It's how many times you get up and do this all over again, ACG. And letter S on the word FAST. Share it. Share this information. Share Dr. Cameron's website. Share it to anybody else. Share my group. Share it. Share. The more shares, the better, because the more information that we disseminate, the more people that we help. And last but not the least, letter T. Not timeout, but teach it. Because when you hear it, you forget. When you see it, you remember. But when you actually teach it, you actually understand it more. So again, thank you very much, Dr. Cameron. I appreciate you. And again, thank you very much, ACG, for watching and listening to our show. I will see you again. Have a great day. Thank you, Dr. Cameron.
It was a pleasure.
Awesome. Great. Be excellent. Thank you, Doc.
All right. Thank you.
Bye-bye.
Bye-bye.